Alrighty guys, we are continuing on with Unit 5 and continuing on with our guidelines for medication administration. So we want to make sure that we are careful if we have to transport any medication, not to drop any or spill or anything like that. With oral medications, we need to make sure that our patient actually is able to swallow and that the medication goes down okay. With any liquid medications, it's important to shake them so that all the precipitate does not actually end up at the bottom. So making sure that it has been shaken well. When pouring a liquid, remember to hold or to have the medicine cup or whatever you're pouring that into on a flat surface, and you're going to read the amount at the meniscus. So the meniscus, if you'll remember from your science classes, is that lowest level of the curve of the liquid. Do not contaminate the cap of the bottle while pouring any medication. Keep all drugs being administered in a safe place. Carefully follow procedural steps for the type of medicine you're administering. And as always, follow our standard precautions and medical asepsis techniques. So we have talked about the 6 rights of drug administration earlier in the semester, but I do want to make sure that we all have a good understanding of this because it's so important to check your 6 rights when you're going to give a patient some medicine. So our first right is the drug, making sure that we have the correct drug, comparing the medication order with the drug selected with the label on the medication container. The right dose. So if the dose ordered and the dose on hand are not the same, remember we have to calculate to find the correct dose. And then it's always important to have someone verify this for accuracy. Make sure your calculations are correct. We're human, we all make mistakes. So have someone just run it by them, say, hey, this is the correct dose, right? Right route, check to make sure the med order and the right route of administration. The right time, make sure that we're using the correct time intervals. Right patient, so using our 2 identifiers, remember name and date of birth, always. And then right documentation. So this is the vital link between us and the providers. And remember, if it's not documented, it's not done. So if you don't document that you gave the medication after you have given it, it looks like we never did. So administering oral medicines, we're not going to spend too much time on this, but remember these are probably the most easily administered. Common devices used would be a medicine cup, water cup, and then a medicine dropper. You may use one that has calibrated by milliliters or by drops. So just knowing our instruments that we're using there for oral meds. Now parenteral medications. So parenteral describes the injection of a substance into the body via any route other than the digestive system. So any other way minus oral medicines. So, or through the digestive system, rectal would actually be considered oral as well. So the most frequently used parenteral routes include subcutaneous, intramuscular, intradermal, and intravenous. So the reasons that we give medications through the parenteral use, through injections, is because of the rapid response time, much quicker than if we're ingesting a medicine. The accuracy of the dosage, so if there's any question about how much medication that you're giving a patient orally, try and use injections because you'll know exactly how much the patient's given. There's no way that they can vomit it out or, not get all of the medicine that you administered. There's the need for injection into a joint or for local anesthesia, and the inability to not administer orally. So some patients can't swallow. Some may be having vomiting. So parenteral medication administration would be more appropriate for those patients. So our supplies, these are the things that we need to use to administer parenteral medications. So we have syringes. They're standard hypodermic syringes. You'll see here some examples, and I'll show you these when you come to do skills as well. There are irrigation or oral feeding syringes. These are much larger. Tuberculin syringes or insulin syringes, those would be here. This is an insulin syringe. You can often tell these by their orange cap. And they have units on them. That's their unit of measurement, is in units, whereas you'll see these other hypodermic needles are actually in milliliters. And then for the tuberculin syringe, it is much smaller, gives us a much smaller dosage here. Let's talk about our needle sizes. So common needle gauges are from 16 to 32, and they vary from 3/8 to 2 inches in length. So when we're talking about gauges, this is how big or how thick the needle is. And when we talk about these numbers, a 16 gauge needle is big. It's the bigger of the needles, whereas a 32 gauge needle is much, much smaller. And then this is the length, so you may have a 3/8 inch needle, much shorter, and then all the way up to 2 inches needing to go much deeper into the body. The medication can be packed differently. You may see an ampule, which is an actual glass ampule where you break off this top part where that blue line is. You literally snap off that glass area to give you the medication inside. You may have a cartridge needle unit where the medication is already in this little cartridge here, and you place it in this system and the needle along with it, and it's ready to go. Or you may use a vial, which is seen here. And in our skills video, I show you how to draw up medication using a vial. Let's talk about intradermal injections for just a minute. So remember, we're going to be doing intradermal injections for things like our tuberculin skin test, which we've already talked about, or for allergy testing. So the anatomic sites, this is where they're going to be administered, is the anterior forearm, halfway below the wrist and the elbow, which you can see here, or on the back below the scapula, so below your shoulder blades. The advantages is this is where the area of hair is sparse. There's no bony prominences to watch out for. Veins and artery are not as close to the surface. Remember, with intradermal injections, we are going literally on the most top layer of the skin here. Very slow absorption of a very small amount of medication. Because we're going into such the top area of skin, you cannot hold a lot of medication in this area. It's great for testing allergies and TB exposure. The angle of injection is 10 to 15 degrees. You can see the needle is almost touching the skin. That angle is so small, just a 10 to 15 degree angle to get to that site of administration. The max amount of volume we can give is 0.1 mLs. We're going to use a small needle here. Remember, the bigger the number, the smaller the needle, so 25 to 27 gauge. And it's going to be pretty short, right, because we're not having to go very far. So 3/8 to 5/8 inch. Our total amount that can be pulled up in the syringe is a 1 ml, because remember, we don't need much medicine to be drawn up in this syringe. We want the patient seated with the arm supported if we are using that forearm. And we already talked about PPDs for that purified protein derivative for our tuberculin skin test and for different allergens for sensitivity testing. Intravenous injection. I do want to note here that MAs cannot administer IV injections, IV medications. However, it is a type of parenteral medication administration, so I did want to just note it here, but remember, MAs cannot give IV medications. So you can give IV injections in many different places, just like with phlebotomy. You have no maximum amount of volume that you can place in an IV. So remember, it's going straight into your bloodstream. So we can actually put just as much medicine in there as we would like. Our needle sizes are going to be much bigger. So 20 to 24 gauge here, 1 to 1.5 inches. The syringe, it depends on how much medication we are administering. The position will also depend on the patient and their comfort. And then our examples of medicines we may be giving IV would be like IV antibiotics, pain medicine like morphine, Benadryl, Ativan, things like that. All different kinds of medications come in IV medications. All right, so subcutaneous injections. We can give subcutaneous injections as MAs, And we can give these in a few different places. So in the abdomen, at least 2 inches away from the navel, so in that fatty area of our abdomen. The posterior aspect of the upper arm, which you can see here in the picture. And then the upper outer thighs. So again, we're thinking subcutaneous injections. This is going into the thicker fat layers. These areas are easy to access usually. And the injections are pretty versatile, so they can be used for short or long-term therapies. So the injection angle we're going to be using here is at a 45-degree angle. Now, I would like to mention that this picture is not my favorite. This is actually not a 45-degree angle. That syringe would need to be angled a little bit lower or a little bit higher so that we're coming in at a 45-degree angle. If you're not careful here, you may continue past the subcutaneous tissue and actually inject into the muscle area. So remember, 45-degree angle here. The most amount of medicine we can administer here is 1 to 2 mLs. We're going to be using a small needle, 25 to 27 gauge. We don't need it to be too long because remember, we're just going to the fatty areas, not the muscle, so 3/8 to 1 inch. And depending on where we are giving the patient the injection will be the patient's position. And some medications that are used for examples here for subcutaneous injections. One very common is insulin. You may be teaching a patient how to perform a subcutaneous injection of insulin on themselves. A lot of patients at home have to give themselves insulin injections in these subcutaneous anatomical sites. Then our last parenteral administration type is intramuscular injections. These are done at a 90-degree angle, as you can see here in the picture. And we have 4 different sites that these medications can be administered in. The first is the deltoid, which you can actually see here in the picture. This is the mid-axillary line, 1 to 3 finger breadths below the acromion process. So the acromion process is the bony most prominence on your shoulder here, and 1 to 3 finger widths below that is where that deltoid muscle lives. The most amount of medicine we can give into this muscle is 1 ml. So depending on these 4 sites, it depends on how much medicine we can actually administer in those areas. Excuse me. So here, 23 to 25 gauge needle, 5/8 to 1.5 inches, depending on really the thickness of this arm. How much subcutaneous tissue do we need to go through depends on the length there. And then a lot of our vaccines can be given through the deltoid muscle. So our hepatitis V vaccine, this is actually the only site it's approved for. Then we have our dorsogluteal site. This is the upper outer quadrant of the buttocks, and this can actually hold up to 3 mLs. So a good site if you have to give a lot of medicine in this area. We're going to go with a little bit bigger of a needle and then a little bit longer, right? Because we have more fatty tissue we have to get through. Our ventrogluteal site. I'm actually going to move to the next slide so you can see where this is actually located. So this is our hip. This is our ventrogluteal site. And how we find this is we put our palm on the greater trochanter. So that's the most bony prominence of our hip. We place our hand up, facing upwards with our fingers. We find the top of the hip, and then we move our middle finger and our pointer finger apart so that we can find right where that muscle would be. So we're touching the iliac crest with our middle finger. Our palm is on that greater trochanter. We're moving our 2 fingers apart here so we find that that ventrogluteal site. This is a preferred site for IM injections, can hold also up to 3 mLs. Again, we're going to be using a bigger needle just like we would for the dorsogluteal site. And again, it would be a little bit longer in length due to the extra fatty tissue here. And then our last site would be our vastus lateralis. And this is appropriate for all ages, and this is the one that is most commonly used in our kiddos. So remember, pediatrics, the vastus lateralis is going to be the most common here. So here you find that site. I'm going to again swap slides to the thigh, the vastus lateralis, 1 hand breadth below the hip, 1 hand breadth above the knee, to our injection site, so the middle third of the vastus lateralis muscle. Again, most appropriate for our kiddos, but you can use it on any age. It can hold up to 2 mLs here.